My name is Annette, and this is Nurse Ratchet. Hi, and we have the best job in the world. We are nurses. See the hat, see the glasses, see the stethoscope, and boy, do we have an invention, or shall we say reinvention for you. But first, let me tell you a little bit about our life as a nurse. We work in the intensive care unit, or ICU for short, where many of our patients are critical ill. These patients have to depend on the nurse to do everything for them. Things that are taken for granted, such as washing your face, brushing your teeth, combing your hair, shaving, eating, turning, walking, and yes, even going to the bathroom. Now, with all that said, a nurse's day at work can be very stressful and busy, and nurses are always trying to figure out ways to make their life easier. As one of my co-workers always said, we work to work smarter and not harder. And that is where my reinvention comes in. Remember when I said that patient depends on nurses for everything, like even going to the bathroom? My invention and proposal is redesigning the bedpan or chucks. The bedpan is an existing product that is designed to absorb body waste by wicking or pulling it away from the skin, which in turn helps to keep moisture away from the skin until the nurse has a chance to clean the patient up. Now, the science behind this is that the wicking or pulling away keeps the skin drier, which helps to decrease a patient's risk of developing skin breakdown that can sometimes lead to pressure ulcer or bed sores. In an article that appeared in the British Journal of Nursing, it stated that individuals who suffer with incontinence, especially in relation to feces, will often be at risk of skin breakdown and develop incontinence-associated dermatitis, or IAD, which if left untreated, can lead to pressure ulcer formation. It went on to say that IAD is caused by increased unrelieved moisture against the skin. Simple, huh? Just put a chucks under the patient and go? What's the big deal? Well, we're glad you asked. Remember when we said that nurses are always trying to figure out ways to make their jobs easier? And I also said that the patients sometimes cannot control their body waste. Now imagine that waste is diarrhea. You know, the kind that runs and runs and runs, and then it dips all over the bed frame on the floor. Yes, that's the kind. Imagine having to clean that up several times. So what do the inventive nurse do? He or she pads and stuff the patient in the bed with diapers, bed pads, sheets, towels, or anything else they can get their hands on. And all of this is done for two reasons: to contain the waste and to prevent the nurse from having to clean up another humongous, like the one I mentioned above. Trust us, once is enough. Now, what do all these layers do? You guessed it, seal the waste to the skin and hold in moisture. And what happened to the patient's skin? You guessed it again. It's just being injured by the moisture and the waste. Now, trust us when we said, and you can trust us. See the hat, see the glasses, see the stethoscope? And that all that nurse wants to do is contain that waste. Evidence has shown that layering or less layering is essential in the prevention of skin breakdown. In the original research article that appeared in the Ostomy Wound Management, it stated that underpads and layers of linens are frequently placed on the patient who are incontinent, patients who have other moisture issues, and under those who are immobile and cannot reposition independently, or for the ease of transfers. Many of these patients are also at risk for pressure ulcers. The effects that these layers have on the tissues are an important aspect of patient care, because we want to give our patient the best care possible. It went on to say that one of the recommendations of the National Pressure Ulcer Advisory is to limit the amount of linens and pads under the patient. This study suggests that overutilization of linen and the use of some incontinent pads intended to protect against moisture-associated damage may actually be an additional risk factor for pressure ulcer development. Therefore, I propose that the existing bed pads be equipped with a built-in diaper that mimics that of the traditional diaper, which would help keep the waste contained and continue to work as an absorbent. This added feature can reduce or eliminate the need of multiple layers, which may also reduce the patient risk of developing skin breakdown. And let's say it together, and make the nurse's job easier. While most while most pads are absorbent, containment of body waste continue to be an issue. This improvement is necessary to improve the quality of care we provide to our patient and to help ease the workload for nursing. Additionally, many medical facilities, such as the one that we work for, are doing away with the traditional diapers and in an effort to decrease layering. But trust us when we say nurses will figure it out. This invention is beneficial for both males and females, but it's a feminist intervention for two reasons. First, majority of the nurses are women, and secondly, majority of the caregivers are women. In an article that appeared in the Boston Globe titled "The Percentage of Women and Men in Each Profession," it showed that 90% of nurses were women compared to only 10% for males. And also, and a side note, many of the male nurses I work with almost barf when their patients poops. And it also said that the personal care aides are about 84.9% are females compared to 51% for males. Also, the American Psychological Association reported that the majority of caregivers who care for an ill or disabled relative are females. Nursing is not limited to, but is dominated by women. Therefore, this engine may be considered a feminist idea that is likely to be more beneficial to women. You see the hat, you see the glasses, you see our stethoscope. Thank you, and we hope that you all invest in our invention. Bye. Bye.